I'm Michael Dickinson. I'm a haematologist at Peter MacCallum Cancer Centre and Royal Melbourne Hospital. I'm also the disease group lead for aggressive lymphoma. At the moment, around the world, there are two types of CAR T therapy that have been approved, or at least two therapies from two different companies. These CAR Ts have in common that they target CD19, which means that they've been approved for CD19 positive tumours, and specifically, in the case of one therapy, diffuse large B-cell lymphoma, in patients who've had two prior therapies or relapsed after autologous stem cell transplantation, and in the case of another therapy, both diffuse large B-cell lymphoma with the same indication or acute lymphoblastic leukemia in patients up to the age of 25, which has relapsed after standard therapies. In Australia, only one agent is currently approved as of early May, and that therapy is approved from a regulatory point of view to be given to patients with acute lymphoblastic leukemia up to the age of 25 or diffuse large B-cell lymphoma after two prior therapies or autologous stem cell transplantation. Unfortunately, right now, only one of those indications is reimbursed by the government, and that's the leukemia indication. We know that in the coming months the regulators are reviewing this decision, but they have a big challenge. CAR T therapies are very expensive. They cost several $100,000 per patient. We don't know exactly what the price is in Australia to government, but they have a big challenge funding this in diffuse large B-cell lymphoma because it is such a common disease. So we also know that there's a second CAR T therapy from a second company, also for the indication of diffuse large B-cell lymphoma, that has been submitted for regulatory consideration in the coming months. We don't know how that's all going to turn out. The fact that acute lymphoblastic leukemia has been approved as an indication gives us some hope that the government and companies may be able to come to some agreement that this treatment will be made available routinely for Australian patients. Overseas, in Canada, Europe and the United States, these treatments are more widely available, and obviously the insurance situations of different countries vary. The Australian government has funded individual patients to go overseas for CAR T therapy after a process of significant review by the regulatory authorities in Australia on a case-by-case basis. And Lymphoma Australia can help direct your haematologist about how to access that process. Right now, CAR Ts are available commercially and freely to the Australian community just in that acute lymphoblastic leukemia up to the age of 25 setting, and it's available at Peter MacCallum Cancer Centre, the Royal Children's Hospital in Melbourne and Royal Prince Alfred Hospital in Sydney. But I know that it's likely that more sites, both in paediatrics and in adults, will come on board over the coming months and year for at least that indication. For other lymphomas, there are a number of clinical trials open or about to open. At Peter MacCallum Cancer Centre, we currently are recruiting to a trial for patients with high-risk, relapsed and refractory follicular lymphoma. And in this situation, it's a third-line treatment, and patients need to have been exposed to two prior therapies, and on each occasion, an alkylator, that is a certain type of chemotherapy, together with an anti-CD20 antibody, of which rituximab and Gazyva are examples. We also have a number of clinical trials that are about to open. One that has just opened is for patients who have had their first relapse of diffuse large B-cell lymphoma. This is a randomized trial comparing CAR T-cell treatment with the standard treatment for relapsed diffuse large B-cell lymphoma, which is called autologous stem cell transplantation. So to be eligible for this trial, patients need to have what we consider a higher risk relapse of disease, which means that for all intents and purposes, they've relapsed within 12 months of beginning their first therapy for diffuse large B-cell lymphoma. If patients are in that situation, they also need to be fit enough that they would be able to tolerate autologous stem cell transplantation, which is a high-dose chemotherapy procedure. So if they're a patient that we would normally offer autologous stem cell transplantation to, then this trial offers a possibility of accessing CAR-Ts. It's a randomised study, which means the computer decides whether the patient receives CAR-T cells as their therapy for their relapsed disease or autologous stem cell transplantation. And that study is open and recruiting now. Around Australia, that study in follicular lymphoma and studies in relapsed diffuse large B-cell lymphoma are beginning to open, and particularly that first relapse situation is currently the focus of industry-sponsored clinical trials. In addition, we have other studies that are soon to open in other types of lymphoma over the coming months, including a small study for chronic lymphocytic leukemia in very specific situations, and particularly in patients who are failing to respond adequately to ibrutinib in the second-line therapy, and also for diffuse large B-cell lymphoma in second or prior relapse. That study will likely recruit a low number of patients initially, and there may well be wait for treatment spots there. In addition, we're aware that the Westmead Hospital has an investigator-initiated study, and I am personally not able to talk about the details of that study, but I do know that it's recruiting. It's a fairly small study in scope, but looking at a specific CAR-T cell treatment for CD19 positive tumours that has been developed at Westmead Hospital. We anticipate that the indications for CAR-Ts are going to expand, and we know that in the roadmap for clinical trials in the coming months there will be more trials coming on board, some of which I can't talk about as of early May. The other thing to say is that CAR-T therapies may become available in the context of clinical trials beyond lymphomas and leukemias, and in other hematological malignancies. There is also work being done in solid tumours currently at Peter Mac in some small studies. At Peter MacCallum Cancer Centre, we have a CAR-T inquiry email, which we endeavour to reply to all inquiries. The other important source of information, of course, is Lymphoma Australia. It's really, really critical for us when we receive inquiries about CAR-T cells that in some way your primary doctor is involved. We need to understand your prior therapies and understand where in your history your disease is, and that information comes best from the haematologist who's looking after you. So really an important first step is to actually speak to your haematologist and say, hey, I've heard about CAR-Ts, is this treatment appropriate for me? And they should usually know and help you navigate the process. But I do come back to the idea that Lymphoma Australia is a very important source. We do our best to update our websites, but often there's newer information than what's on our websites, and so that medico-to-medico contact is often a very important shortcut too.